You ready? All right. Hi, everybody. I'm San Francisco Mayor London Breed, and I am here today with the Director of the Department of Public Health, Dr. Grant Colfax, as well as Juliana Nono.
Garola Nuno, yeah.
Yes, sorry about that. And Dr. Hillary Cunnins. And today we're here to make an exciting announcement about what's happening in San Francisco around the number of overdose deaths. Now, to be very clear, this has been a very challenging time, not just for San Francisco, but from cities all over the country. Fentanyl has had a devastating impact on communities and on people's lives, and the loss of one life, of course, is one too many. And so we've worked hard in San Francisco to try and combat these issues by providing a variety of not just services and support, but also accountability. It's all of the above. It's not just one thing that's going to help to make things better for the people who are struggling with addiction. It is everything. And we have been doing everything. And when I say we've been doing everything, I'm really proud and grateful to the work that our law enforcement agencies have been doing with the Drug Enforcement Agency and the U.S. Attorney's Office, as well as some of our state resources and local law enforcement, as I said, to really try and focus on accountability and make arrest to try and stop people from selling poison on the streets of San Francisco. But we also know that addiction is complicated and it's very challenging. And it is, touched the lives of so many people, not just those who suffer from addiction, but those who have family members and friends who they want to get help and treatment. And what I am most proud of is the work that the city has been doing to put everything on the table, to make abstinence-based treatment a real option like never before that comes with treatment beds, including places like Her House, which is for mothers who have their children who can go through treatment in recovery and still live with their children, and programs that provide a safe, affordable place for people to call home as they go through the process. And I gotta say, what we have done to triple the number of resources through the Department of Public Health and our incredibly talented, hardworking city employees who go out there and who implement the work that we want to see done around outreach, around support, around investing and partnering with our nonprofits like Positive Direction Equal Change or Co-Tenderloin, who are out there in the middle of the night offering services, offering support. It has been really transformative. And to look at the data, the month of October, since we started keeping track of overdose deaths, we have hit a place where this is the lowest number of overdose deaths reported in a month. And we have seen continual declines for the past 7 months, every single month of overdose death because of the work that we are doing together. It is remarkable, and it is saving lives. And I am so happy to be here to talk about how all of this together is making the kind of difference that we all want to see in San Francisco, and more importantly, just how we are starting to see more people accept treatment. We're starting to see more people accept treatment. We're starting to see more people accept the kind of options we have, whether it's abstinence-based, things like buprenorphine or methadone or what have you. It is starting to work because the people are out there doing the work and making sure that folks know it's not a one-size-fits-all, but the options in this city exist. And the options in this city, it's saving lives. So I am grateful that today is, a way in which we can talk about what we are doing, a way in which we can, just let the public know how complicated this problem is, but more importantly, how all of these things that we are doing are coming together for the better. We've increased our behavioral health beds. I mean, you name it, we've done it all. And we are starting to see the results of all of this hard work finally come together, and we are on the decline of overdose deaths in San Francisco like never before. So I'm grateful again to the Department of Public Health and all the hardworking staff, to so many organizations that we partner with to help with treatment and support, to like the families and the folks in the community who continue to work with us to understand that we're talking about people's lives, and it's much more complicated than what you might say in a soundbite or put on social media. There are hardworking people out there saving lives every single day, and this data is proof that it is working, and I am so grateful. And with that, I want to introduce the Director of the Department of Public Health, Dr. Grant Colfax.
Good afternoon, everybody, and thank you, Mayor. So appreciate your being here today to share this hopeful news. Last month, 32 people died of an accidental overdose, which is more than 50% fewer deaths than San Francisco experienced in October of 2023, just last year. Overall, San Francisco has a more than 20% decline in fatal overdoses to date this year compared to last year. We are making progress, but there are still too many lives lost to overdose. And these deaths continue to underscore the work that needs to be done. At DPH, in collaboration with partners across the city, we are rapidly expanding services to provide people with more options to treat fentanyl addiction and other substance use disorders. This includes the recent launch of a 16-hour on-demand buprenorphine program, the expansion of methadone treatment and contingency management, as well as the expansion of residential treatment. And Mayor, you talked about how hard people are working on the streets every day now to save lives. I just want to share that this weekend I was out with Code Tenderloin, and they were reaching people at 6th and Mission at night, getting a doctor on the phone and getting them the buprenorphine prescriptions that they need to survive. It's incredible. They were so busy. They were so busy. The doctors were talking to them on the phone every minute. As we expand access, we are seeing higher rates of people starting these life-saving medications and in residential treatment. So on-demand buprenorphine has connected over 1,500 people on the street, with 43% of people filling a buprenorphine prescription, more than double the national rate. And this was a pilot program that we just recently expanded in October. We are expanding what works, and now across San Francisco, from 8 a.m. to midnight, anybody can call, talk to a healthcare provider, and get a buprenorphine prescription. When a bed is provided along with a buprenorphine prescription, prescription rates again double to 90%. We've also seen about a 35% increase in residential treatment admissions for substance use disorder in this year compared to the prior fiscal year. And new admissions to our methadone treatment programs have increased by nearly 34% through July of this year. And our unique number of clients accessing buprenorphine in our system of care is up by 46%. As important as providing treatment and recovery, it is also making sure that people know that these services are available and life-saving. That's why this month we have launched the Living Proof campaign that features 9 San Franciscans in recovery. That's why I'm so happy that Juliana is here. She's part of the Living Proof campaign with her family, and it's the first social marketing campaign across all sorts of media to let people know that treatment works and where they can get treatment. We need to continue to uplift people with lived experiences who also inform how we do our work every day. I want to also thank Dr. Hillary Cunnins, our Behavioral Health Director, for her leadership as we continue to decrease overdoses. And Dr. Cunnins, please welcome to make your remarks. Thank you.
Thank you, Dr. Colfax, and many our thanks to Mayor London Breed, who is joining us today, and Juliana Garola Nuno for joining us today, along with her incredible portrayal of what it means to be in recovery for San Francisco's to learn from. We are proud and excited, as you just heard, to launch the Living Proof campaign. Our goal is to educate people who might benefit from care, their loved ones, and we want people to know in San Francisco that medications and other treatment is available to help folks recover from drug addiction and stay alive. Methadone and buprenorphine are 2 most effective treatments for opioid addiction, reducing risk of overdose and death by 50%. Opioid addiction can include addiction to substances such as fentanyl, heroin, as well as prescription pain relievers like oxycodone and hydrocodone. We are doing everything and trying innovative approaches to make treatment more available in San Francisco. You heard about the telebuprenorphine program, and since September 30th, that program is available 16 hours a day. That means that folks interested in treatment can speak with a healthcare professional in the moment to learn more about the medication and to find out how to get it right away. We started offering this program in March in association with our Night Navigation Street Care team, which you just heard about. The Night Navigator program, operated by our partners, Code Tenderloin, is able to connect people up into the late hours of the evening. And as you heard, 40% of people who had a telehealth call outside picked up their medication. This is more than twice the national average, and that led us to expand the program to 16 hours a day. We have accepted more than 2,000 calls from more than 1,600 individual people. We know also that individuals sometimes seek care but don't understand how to access it. We know that family and loved ones may be confused about where to turn when trying to help someone. And we know that role modeling is one of the most effective strategies to inspire people to seek treatment. And that is why we developed and launched the Living Proof campaign. We feature 9 people, San Franciscans, in the campaign, including Juliana, who are truly role models to people who have themselves experienced overdose and who have active addictions. Juliana, I want to thank you so much for your generosity in sharing your recovery journey, being willing to speak to the public about what it has been like for you and your family. And thank you so much. We are really inspired by you. Thank you.
Sorry. Okay. So hi, I'm Juliana, as you all have heard, and I'm proud to stand here today as someone who recovered from opioid addiction. My journey wasn't easy, but it did teach me one powerful truth, and that is recovery is possible when we are given the right support. I joined the Living Proof campaign because I know how isolating addiction can feel, and that here in San Francisco, there are life-changing services available. There are services available to help you start your recovery journey, even if it's just taking the first small step. But not every person struggling with addiction knows about these resources. And I know that when I was in my addiction, I had no idea of any of these services. But I want to change that. After battling addiction for many years, my life took a pivotal turn when I had my daughter. She gave me the strength and the purpose I needed to seek out help and work towards getting clean. It wasn't easy, but through determination and support, I found my way to recovery. And a lot of that is because of the services and the chance that San Francisco gave me. Now I feel deeply responsible to share my story, not just to celebrate where I come from, but to remind those who are still battling addiction that I believe there is, that we need to bring a voice to the recovery group, and we can break down those barriers. My goal is to help others see that they are not alone and that recovery is possible, no matter how far they feel that they have fallen, that there is help and so many people who care that will walk the journey with you. Together we can build a community that heals and uplifts. Thank you.
Thank you. Thank you, Juliana, for your courage, and we are so happy to have you here with us today, and really grateful for your story because we know that story will also save a lot of lives, so it's very meaningful to have you here. And again, thank you all so much for being here. This is very promising news, but we know that there's still more work to be done. But it demonstrates that everything that we have been doing is working and it's on the right path. And we look forward to seeing consistent declines in the months to come because of all the investments we've made and all the hard work of the people who are out there day in and day out doing the work to help save lives. Thank you so much.
We do have a couple minutes if there are any follow-up questions.
Ezra Romero here at KQED. Are you concerned that this project could slow down moving away from treatment and choosing a harsher law enforcement response to overdoses and drugs?
I'm sorry, I didn't hear the first part.
Are you concerned moving towards like harsher?
Well, I don't know what's to come, but I do know that we've worked very closely with the Biden administration, and the reason why we've been able to focus on accountability with, the arrests that we've made, it's been solely focused on dealers, not on users. And locally, we focused on users, and the goal, again, is to get people into treatment, not to leave them behind bars. So I hope that we have set the appropriate stage for us to continue down this path, because what we're doing is working, and we want it to continue. If we continue to keep things the way they are and enhance what we're doing, we will continue to see remarkable results. I'm not certain, I can't speak to what the incoming president will or won't do, but my hope is that what we have been doing here in San Francisco can be used as a model for other cities to follow.
How important is it, as you're exiting and your legacy of being the mayor of San Francisco, do you want this to be one of the things that you're remembered for?
Well, I definitely want all of the work we've done to help combat this issue to be just continued. Like, ultimately, as mayor, what it was most important to me is to save lives. And that's why I work so closely with the recovery community. That's why I put Proposition F on the ballot that says if you want money from the city, you have to be in treatment. But we also had to make sure those treatment options were a lot easier to access. And that's why people from Code Tenderloin, for example, they are out there in the middle of the night putting their lives on the line because they too have had those kinds of experiences themselves, and they want to help people. So my hope is that this works and that we continue along this path and we keep the investments going so that we can save lives, because this is what it takes. Treatment beds, treatment options, all of the above, not one thing or another, but it's everything. And providing people with options, but making sure they know what those options are and that we are meeting people where they are, because they might not be ready at 9 to 5. It may be in the middle of the night, midnight, and we have to be prepared for what that entails. And my hope is that, the incoming administration sees that and sees the hard work of these people who are out there doing it and continues to make those investments. And then if that happens, we will still see the trend decline.
Another final question?
Juliana. Last name is Gurrolanonuno.
Is there anything else that's going to be done with this program in the near future beyond the social media campaign?
Do you want to talk about that, Dr.
You can do it, Hillary. Living proof. He's talking about living proof.
We will be expanding its reach via print, social, and digital campaigns. We'll be tracking the uptake of the campaign, looking at ways in which we can continue to reach people and reach more people. We are also distributing posters to providers and partners across the city in order to deepen how visible it is in community and with a variety of community members.
Thank you so much.
And just to be clear, you can always call 311 and they can connect you. Thanks.